Hello, everybody. Welcome back to the channel. Story today is VA announces major boost for thousands of veterans by Amanda Greenwood. The Department of Veterans Affairs has resumed the rollout of its long-delayed federal electronic health record system, launching the technology at 4 Michigan VA medical centers after nearly a 3-year pause. The deployment marks a significant milestone for a modernization effort to allow VA doctors and nurses to spend more time with patients and less time struggling with outdated technology, according to an agency news release. The system went live on April 11th at VA facilities in Ann Arbor, Battle Creek, Detroit, and Saginaw. According to the VA, the Michigan rollout is the first wave of 13 planned deployments scheduled for 2026. As part of a broader effort to establish a single, unified electronic health record across all VA medical facilities nationwide. Why the VA health record system matters? The federal EHR project is designed to replace a patchwork of older record-keeping systems with a modern platform shared across the VA, the Department of Defense, and participating civilian health providers. The overreaching goal is to allow veterans' medical records to follow them more seamlessly as they move between military service, VA care, and private providers. VA officials say the system will help reduce duplicate medical tests, improve continuity of care, and sorry, give clinicians easier access to complete patient histories, particularly during emergencies or when veterans need care at new facilities. According to the Federal News Network, the Defense Department fully transitioned to the same EHR platform in 2024, making interoperability a key provider for the VA as it resumes the deployments. What this means for veterans in Michigan? For veterans receiving care in Michigan, the VA says the new system should gradually improve access to medical records, coordination between providers, and the overall efficiency of appointments. What has changed since the pause? The VA halted most EHR deployments in 2023 after reports of system outages, workflow disruptions, and patient safety risk at early rollout sites, the Federal News Network reported. Since then, the department says it has addressed hundreds of technical and usability issues identified during initial implementations. The agency also emphasized standardizing the system across facilities rather than allowing local customization that previously complicated deployments. In addition to this, the VA has streamlined the management of the project by removing bureaucracy. It's increased direct engagement with local medical centers and expanded staffing to support transitions to the new system. The VA said dozens of staff were hired for Michigan rollout alone, with plans to bring in about 400 personnel system-wide to support future deployments. What happens next? Well, following the Michigan rollout, the VA plans to continue deploying the EHR system to additional VA medical centers throughout 2026. According to the Federal News Federal News Network, in June, the VA plans to deploy the EHR system to 3 VA centers in Ohio and 1 in Kentucky, and in August to 3 centers in Indiana. By October, it is set to be live in Alaska as well. So hopefully it's going to be a better system. Of course, we have to wait and see on that. You know, I think we all been there and gone through that this is the best system there is out there, and find out it's a troublesome system. So let's hopefully this system here is a better system and it's less troublesome and easier to get in touch with your doctors and medical staff there. Um, so hopefully this story helps you out. Hope it's some interest to you. I appreciate you stopping by. Y'all have a great day, great night, whatever the case may be. We'll see you next time.